Dr. Vaccaro, it seems to me that one of the things that patients and doctors worry about most is infection. Do you find that to be true?
Absolutely. One of the things that we see occasionally, but fortunately rarely, is a wound getting infected.
What are the things that you do during the operation and before and after the operation to try to avoid infection?
Number one, we want to optimize the host, which is the patient, make sure they're healthy. Number two, they bathe the night before. We give special agents for them to bathe. The morning of, we don't shave the day before. We clip the hair, because if you shave, that increases the risk of infection. We give antibiotics intravenously before we make a skin incision. We use solutions in the operating room that may or may not have antibiotics. Sometimes we actually put antibiotics in the wound itself, and then we make sure we have a sterile environment throughout the process in the perioperative period.
Even with doing all of that, are there some times where infections still happen?
Right, the CDC, which is the Centers for Disease Control, comes out with national averages. We try to make sure we're comparable in any institution to that. So if you have a microdiscectomy, the infection rate is less than 1%. If you have a fusion, it could be anywhere from 1 to 5%. The population at greatest risk are patients with spinal cord injuries. They're an increased risk.
And it's just like you can't avoid having a cold. Sometimes you just can't avoid getting an infection.
Unfortunately, that's true.
What should a patient be looking for as far as signs and symptoms of infection?
First thing, you just don't feel good. You feel tired, you lose energy. 2, drainage from the wound. It can be clear fluid or it can be pus. 3, you have a temperature. 4, the wound looks red, it looks swollen. You could feel fluid below the skin. That means there may be a problem.
And what should a patient do if they see any of those telltale signs?
Call the doctor and go see the doctor.
Great. And hopefully, if you catch it early, is it something that can be addressed?
Well, we could address it at any time. The sooner the better.
Thank you so much, Dr. Vaccaro.
You're welcome, Ms. Hansen.
If you have questions or would like to schedule an appointment with a Rothman physician to discuss both non-operative and operative treatment of your spine, please call 1-800-321-9999 or request an appointment online.